Welcome, students, to today's lecture on hyphema, a condition characterized by the presence of blood in the anterior chamber of the eye. Hyphema is a fascinating yet complex topic in ophthalmology that requires a thorough understanding of the anatomy, physiology, diagnostic approaches, and management strategies. Today, we will delve into the intricate details of hyphema, exploring its various aspects and discussing the latest advancements in its treatment. The anterior chamber, located between the cornea and iris, maintains eye shape and supports vision. It contains aqueous humor, which regulates pressure. Hyphema, or blood in the chamber, disrupts function and can cause serious issues. Knowledge of anterior chamber anatomy is important for managing hyphema. Traumatic hyphema, caused by eye trauma, results in blood accumulation in the front of the eye. Its distinctive features include a history of trauma, sudden symptoms, and visible blood. Accurate diagnosis and management require knowledge of its mechanisms and characteristics. Hyphema can cause increased pressure in the eye, which can lead to permanent damage if not treated properly. Treatment options include eye drops, oral medications, and surgery if needed. Prompt treatment is important for managing elevated intraocular pressure in hyphema patients. Hyphema shares several clinical features with other conditions presenting with red eyes. Therefore, it is crucial to differentiate hyphema from other causes to ensure appropriate management. Systematic evaluation and diagnostic approaches, such as a thorough medical history, visual acuity assessment, slit lamp examination, and fundoscopy, are essential for accurate diagnosis. Differential diagnoses to consider include conjunctival hemorrhage, orbital fracture, and various inflammatory conditions. Recognizing the distinguishing features of hyphema and understanding the diagnostic approaches are vital for providing the right management. In severe cases of hyphema, surgical intervention may be necessary to remove the accumulated blood and facilitate healing. Several surgical techniques are employed to evacuate the hyphema, including anterior chamber washout, irrigation, and aspiration. These techniques aim to restore the normal anatomy and reduce the risk of complications associated with prolonged blood presence in the anterior chamber. Understanding the various surgical methods and their indications is essential for providing appropriate surgical management in severe cases of hyphema. Hyphema in pediatric patients presents unique challenges due to anatomical and physiological differences compared to adults. The smaller anterior chamber size and higher risk of rebleeding in children necessitate tailored management strategies. Pediatric hyphema requires careful monitoring, bed rest, and close follow-up. Pharmacological interventions may need to be modified, and surgical approaches must consider the age-related anatomical differences. Understanding the specific considerations and management strategies for hyphema in pediatric patients is crucial for optimal outcomes. Patients with recurrent hyphema can suffer from impaired vision and decreased quality of life. Identifying factors like high intraocular pressure, clotting issues, and structural abnormalities is important for effective treatment. Medical management, surgery, and addressing the underlying cause can be employed. Individuals with sickle cell disease are at an increased risk of developing hyphema due to abnormal red blood cell characteristics. The pathophysiology of hyphema in sickle cell disease involves a combination of vaso-occlusion and hemolysis, leading to blood accumulation in the anterior chamber. Treatment approaches include management of sickle cell crisis, optimizing oxygenation, and addressing underlying ocular complications. Understanding the unique pathogenesis and optimal treatment approaches for hyphema in patients with sickle cell disease is vital for delivering appropriate care to this specific population. Clotting disorders in hyphema patients pose diagnostic challenges and require additional considerations. Accurate diagnosis is difficult due to overlapping symptoms with other conditions. Lab evaluations and management strategies involving clotting factors and medications are crucial for timely and appropriate treatment. Anterior chamber washout is a surgical procedure that can help remove blood and debris from the front part of the eye in severe cases of hyphema. Proper patient selection and technique are important for good results. Understanding the role of this procedure is important for doctors. Rebleeding after hyphema is a significant concern, as it can lead to complications and visual impairment. Pharmacological interventions have been investigated to reduce the risk of rebleeding and improve outcomes in hyphema patients. Medications such as antifibrinolytics, cycloplegics, and topical corticosteroids have shown varying degrees of efficacy in preventing rebleeding. Understanding the mechanisms of action and evidence supporting the use of these pharmacological agents is crucial for implementing appropriate management strategies. Traumatic angle recession refers to the structural damage to the drainage angle of the eye following trauma. It has been recognized as a significant risk factor for recurrent hyphema. Understanding the relationship between traumatic angle recession and recurrent hyphema is crucial for risk stratification and tailored management. Identification of associated risk factors, such as the degree of angle recession and the presence of associated ocular injuries, can guide treatment decisions and prognostication. In conclusion, understanding and managing hyphema is essential for ophthalmologists. This lecture has laid a foundation for your knowledge and inspired further study. Stay curious and keep seeking advancements. Thank you for your attention.